Hello everyone, Dr. John Bartemus here with a functional medicine client, Kate, who is 25 years old and excited to share with us today a testimonial. So Kate, thank you for being here, and why don't you share with us what were you dealing with that first brought you into care?
Sure, yeah. So about 7 months ago I was dealing with a wide variety of problems that at that time didn't really seem to have any correlation to each other. So poor digestion, a lot of digestive issues, irregularity, things of that nature, as well as hormonal issues. I wasn't cycling regularly, or not at all actually, and overall just general fatigue, really not feeling like myself, gaining some weight even with healthy habits, and was just feeling really frustrated.
Okay, so I know a little bit more about you, so why don't you, have you been diagnosed with anything in the gut?
Yeah, absolutely. So when I was 15 years old, I was diagnosed with Crohn's disease, which is an autoimmune disorder, and had been through a variety of different medications and even some major surgery to help combat the symptoms. And I had been doing okay on a paleo-style diet, managing those symptoms, so I thought. And about 8 months ago I started having some issues, and that's when I got kind of frustrated because I thought I'm doing all the things that I should be doing and it's still not enough. So definitely was feeling frustrated at that point.
And the issues were related to your cycle that you're talking about?
Yes, okay. Yeah, absolutely. So, even though I wasn't on any types of birth control or anything like that, I still wasn't having a cycle, which for years I had been told by, traditional doctors is fine if you're active and this and that, but for me it didn't feel right. I didn't feel right in my body, so definitely wanted to figure out what was keeping me from being in a regular rhythm.
Okay, so what we did was embark on some functional medicine, which is looking at Kate as an individual, and what we do is use testing to figure out biochemically and physiologically what's going on and causing maybe these cycle issues or these Crohn's issues, and how can we address those. So how did we address them, or how have you been addressing them, and then what have you experienced?
Yeah, absolutely. So, I mentioned that at the time it didn't seem like there was any correlation between all the different types of problems and symptoms that I had. What was great is that after we did some diagnostic testing, all the pieces came together and I really got a picture of what was going on in my body and how we could fix it. So one of the issues was a leaky gut, so really contributing to the digestive issues that I had been having. So by following a more specific diet protocol called the specific carbohydrate diet, I was able to really start allowing my body to heal, and that obviously helped with my Crohn's disease as well, and managing that disease. Additionally, we looked at my thyroid health and some other factors, and overall was in kind of a state of adrenal fatigue. So we looked at how I could address that with some different supplements to kind of support my adrenal system, and that's been getting them back on the right track. So
good. So energetically you're feeling good?
Much better, yes.
And you're exercising?
Yeah, I kind of, at the point that I had come to see you, I pretty much stopped exercising because I didn't feel like it was getting me anywhere, and it was really driving me into the ground even more than I was feeling normally. So I've been able to, run and play with my dog and weight lift and do all the fun things that I want to do as an active person, and I don't have any, prolonged recovery time. It's, I feel great every day.
Excellent. So this is not a finished picture. We've been working with Kate for about 6 months, and how's the cycle? What's the update on that?
So it's regular, monthly, great, and I would say probably for the first time since I was 17 or 18 have really been in a normalized cycle like this, so that's fantastic.
Okay, great. So we're going to continue care because there's, as we correct things, the onion, the layers kind of peel back. So what would you say to someone, first of all, did it happen overnight? And second of all, what would you say to someone who's kind of on the fence about care?
Yeah, absolutely. So I will say, if you're feeling frustrated that you're following the traditional types of recommendations that you get online for things like that, and nothing seems to be working, it's probably because there's a bigger picture that you haven't uncovered yet. And it isn't an overnight process by any means. It's hard work, but it's sustainable results. So I don't have any fear that I'm going to have these same issues again, because I know what causes them and I know how I can prevent them from happening again. So, I would say if you're feeling frustrated and you want long-term results versus maybe just short-term or maybe even potentially damaging results, functional medicine is really the route to go.
Awesome. Well, thank you, and there it is from someone who's experienced at seeing great results. I'm Dr. John Bartemus, and I look forward to helping you soon. Have a great day.